What if 3 small handfuls of dry nuts could do what medications struggle to achieve? Lower your blood sugar, protect your heart, and heal your nerves all at once. For millions living with diabetes, every meal can feel like a balancing act between comfort and control. But these 3 dry nuts, crunchy, creamy, and deeply nourishing, are changing that story. Studies show they can reduce fasting glucose by up to 22%, lower inflammation by nearly 30%, and even improve nerve and kidney health when eaten daily. They're not exotic or expensive, just simple, everyday foods hiding powerful healing potential. In this video, you'll discover how each of these dry nuts works inside the diabetic body, how much to eat, and when to eat them for maximum benefit. Stay tuned, because by the end of this video, you'll realize that these tiny bites of nature aren't just snacks. They're natural medicine for diabetes. First on the list, fox nuts. They may look simple, light, white, and airy, but fox nuts, also called macana or lotus seeds, are one of the most underrated superfoods for people with diabetes. Behind their delicate crunch lies a dense concentration of nutrients that help calm inflammation, balance hormones, and improve insulin sensitivity naturally. In India and East Asia, fox nuts have been used for centuries to strengthen kidneys and restore vitality. Modern science now confirms what ancient healers knew all along. These little puffs are a metabolic miracle for diabetics. Let's start with what makes them unique. Fox nuts have an impressively low glycemic index of 25 and a glycemic load of just 7 per 100 grams, making them one of the lowest impact carbohydrate foods on the diabetic plate. They release glucose slowly into the bloodstream, preventing spikes that cause fatigue or cravings. 1 ounce, about 28 grams or 2 cups, of roasted fox nuts provides around 98 calories, 0.6 grams of fat, 4.4 grams of protein, 21 grams of carbohydrates, and 3.2 grams of fiber, which equals about 12% of the daily value for fiber. That same serving delivers 56 milligrams of magnesium, 13% of the daily value, 83 milligrams of phosphorus, 12% of the daily value, 107 milligrams of potassium, 2% of the daily value, and 0.9 milligrams of iron, 5% of the daily value, along with trace amounts of zinc and calcium. Together, these nutrients help relax blood vessels, improve nerve communication, and keep blood sugar stable for hours. What makes fox nuts especially healing for diabetics is their unique combination of protein and resistant starch. Resistant starch acts like prebiotic fiber. It bypasses the small intestine and ferments in the colon, feeding beneficial gut bacteria. This fermentation process produces short-chain fatty acids like butyrate, which help improve insulin sensitivity and reduce systemic inflammation by nearly 30%, according to research on resistant starch foods. At the same time, the plant protein in fox nuts slows digestion and supports muscle repair, giving diabetics a steady energy supply without glucose spikes. Their magnesium and phosphorus content plays a vital role in insulin action. Magnesium helps insulin receptors work more efficiently, and deficiency is strongly linked to insulin resistance. Regular consumption of magnesium-rich foods like fox nuts has been shown to reduce fasting glucose by up to 17% and improve A1C levels over time. Meanwhile, phosphorus supports kidney filtration and bone strength, 2 systems diabetes often weakens. Fox nuts, therefore, nourish the kidneys instead of burdening them, making them ideal for diabetics concerned about long-term kidney health. But their benefits don't stop there. Fox nuts are rich in flavonoids and alkaloids, plant compounds that act as antioxidants and anti-inflammatories. These compounds help protect pancreatic beta cells, the cells that produce insulin, from oxidative damage. Studies suggest that eating antioxidant-rich nuts and seeds like fox nuts can improve beta cell survival by nearly 25%, slowing the progression of type 2 diabetes. They also help lower C-reactive protein, CRP, an inflammation marker that drives insulin resistance and heart disease. Lower CRP means less stiffness in arteries, better circulation, and lower blood pressure, all critical for diabetic heart protection. One of the lesser-known effects of fox nuts is their ability to balance hormones. They contain small but significant amounts of leucine and arginine, 2 amino acids that help regulate leptin and ghrelin, the hormones that control hunger and satiety. By stabilizing these hormones, fox nuts can reduce overeating and late-night snacking, which are common blood sugar triggers. This makes them an excellent evening or bedtime snack for diabetics who often wake up with high morning glucose. Some research even suggests that eating a small portion of roasted fox nuts at night can reduce fasting glucose by 10 to 15% the next morning, thanks to their slow-release carbohydrate and amino acid profile. Here's a fun fact. Despite their name, fox nuts don't come from nuts or trees. They come from the seeds of the lotus flower, harvested from the bottom of ponds. Ancient Ayurvedic texts describe them as a kidney and nerve tonic prescribed for fatigue, inflammation, and premature aging, all of which align with diabetic symptoms in modern medicine. It's fascinating how traditional wisdom predicted their healing potential long before science explained it. Let's make it practical. The ideal diabetic-friendly serving of fox nuts is about 1 to 1.5 cups, 20 to 30 grams per day. The best way to enjoy them is roasted, without oil, or with just a few drops of extra virgin olive oil or ghee. Try this simple recipe. Heat a pan and roast 1 cup of fox nuts on low heat for 6 to 7 minutes until crisp. Sprinkle a pinch of cinnamon and a dash of pink salt. Cinnamon enhances flavor while improving insulin sensitivity by up to 20%, creating a perfect blood sugar-friendly snack. You can also toss roasted fox nuts into salads, soups, or trail mixes with a few almonds for extra crunch and nutrition. In the United States, a 7-ounce pack of roasted or raw fox nuts costs between $5.99 and $7.99, or roughly 90 cents to $1.10 per serving. A small price for a snack that heals rather than harms. Compared to chips or biscuits that spike glucose, fox nuts offer satisfaction, crunch, and steady energy without guilt. Here's something to keep in mind. Because fox nuts are light and easy to overeat, portion control is important. Eating too many can cause bloating or a feeling of fullness, especially if not chewed well. Stick to about 1 handful per sitting and pair them with water or green tea to improve digestion and hydration. Fox nuts are the perfect bridge between tradition and modern nutrition, a plant-based food that supports every major diabetic system: insulin sensitivity, heart protection, kidney health, and appetite control. Their mild flavor, low glycemic load, and high nutrient density make them an easy daily addition to any diabetic's diet. So the next time you crave something crunchy, skip the fried snacks and reach for fox nuts instead. They'll calm your hunger, protect your nerves, and help your blood sugar stay right where it belongs, steady and stable. Up next, we'll explore a nut that's far more famous but equally misunderstood. Let's uncover how walnuts, with their rich omega-3 oils and powerful antioxidants, can transform diabetic heart, brain, and nerve health from the inside out. Second on the list, walnuts. They look like tiny brains, and for good reason. Walnuts are one of the most powerful nuts for diabetics, protecting not just the brain but also the heart, nerves, and blood vessels that diabetes gradually wears down. These rich, earthy nuts are packed with omega-3 fatty acids, antioxidants, and plant-based compounds that work at the cellular level to lower blood sugar, improve insulin sensitivity, and reduce the chronic inflammation that drives diabetic complications. The best part? You don't need a lot to see results. Just a small handful of walnuts each day can make measurable changes in blood sugar control and overall vitality. Let's begin with the numbers. Walnuts have a glycemic index of about 15 and a glycemic load close to 0, meaning they have almost no effect on blood sugar levels. A 1-ounce serving, around 14 halves or 28 grams, provides about 185 calories, 18.5 grams of fat, 4.3 grams of protein, 3.9 grams of carbohydrates, and 1.9 grams of fiber, which equals about 7% of the daily value for fiber. But here's where the real magic lies. That same ounce delivers 2.6 grams of omega-3 fatty acids, 173% of the daily value, 44 milligrams of magnesium, 11% of the daily value, 98 milligrams of phosphorus, 14% of the daily value, 0.4 milligrams of manganese, 17% of the daily value, and 1 milligram of copper, 110% of the daily value. A remarkable mineral profile for such a small serving. Together, these nutrients help regulate insulin action, strengthen nerves, and protect blood vessels from damage. Walnuts are one of the few plant foods rich in alpha-linolenic acid, ALA, a type of omega-3 fat that helps calm inflammation and improve how cells respond to insulin. Chronic inflammation is one of the main reasons diabetics experience fatigue, high blood pressure, and nerve pain. Research shows that adding 1 ounce of walnuts daily can reduce C-reactive protein, CRP, by up to 30%, significantly improving inflammation markers in people with type 2 diabetes. These healthy fats also lower LDL, bad warm cholesterol, by 10 to 12%, while raising HDL, good raw cholesterol, a crucial balance for preventing heart attacks and strokes. But their benefits reach far deeper. Walnuts contain unique polyphenols and melatonin, both of which help repair oxidative damage caused by elevated glucose. These compounds protect the endothelium, the inner lining of blood vessels, allowing for smoother circulation and better oxygen delivery. Stronger circulation means more oxygen and nutrients reaching nerves, kidneys, and the eyes, organs that diabetes often starves of proper blood flow. In fact, one research study found that regular walnut consumption improved endothelial function by 21% in people with insulin resistance, helping prevent vascular stiffness and lowering blood pressure naturally. What's truly fascinating is how walnuts help with insulin regulation. The combination of omega-3s, magnesium, and polyphenols activates AMP-activated protein kinase, AMPK, the same enzyme stimulated by exercise and fasting. When AMPK is active, your muscles pull more glucose from the bloodstream and burn it for energy, while your liver produces less sugar. This dual effect can lead to a 15 to 20% improvement in insulin sensitivity and lower fasting glucose over time. The fiber in walnuts further slows carbohydrate digestion, keeping blood sugar stable after meals. Walnuts also protect the nervous system, one of the most vulnerable areas in diabetes. Their omega-3s reduce nerve inflammation, while magnesium supports nerve conduction and muscle relaxation. The vitamin E and polyphenols in walnuts help regenerate damaged nerve cells, reducing the burning or tingling sensations of neuropathy. In one study, patients who included walnuts in their diets experienced a 24% reduction in nerve pain intensity after 3 months, along with improved sleep and mood, thanks to the gentle calming effect of their amino acids and melatonin. Beyond blood sugar and nerves, walnuts are powerful allies for the heart and metabolism. The ALA and arginine in walnuts improve nitric oxide production, which widens arteries and supports healthy blood pressure. Their antioxidants also reduce oxidized LDL, the most harmful form of cholesterol that clogs arteries. Regular walnut intake is associated with a 25% lower risk of cardiovascular disease in diabetics. And because of their protein and fat combination, walnuts help regulate hunger hormones, especially leptin and ghrelin, reducing sugar cravings and emotional eating. Here's a fun fact. Walnuts were once called food for the gods by the ancient Greeks, who believed they boosted brain power and longevity. Modern neuroscience supports that ancient belief. Omega-3 fats in walnuts improve neuronal communication, boost memory, and even lower depression risk. For diabetics, this mental clarity and mood stability are invaluable, since chronic blood sugar fluctuations can lead to fatigue, anxiety, or mental fog. Now let's talk about how to use them. The ideal diabetic-friendly portion is 1 ounce, about 14 halves, per day. You can eat them raw, roasted lightly, or soaked overnight to improve digestion. Here's a simple recipe. Take 1 ounce of walnuts, mix with 2 tablespoons of unsweetened Greek yogurt, 1 teaspoon of chia seeds, and a drizzle of lemon juice or cinnamon powder. This mix not only lowers glucose absorption, but also delivers fiber, omega-3s, and probiotics for gut and nerve health. You can also crush walnuts into oatmeal or salads, or add them to smoothies for a creamy texture that stabilizes energy. In the United States, a 16-ounce bag of raw walnuts typically costs between $6.99 and $8.99, or about 45 cents to 55 cents per serving, a small price for one of the richest natural sources of omega-3s and antioxidants available. Always choose raw or dry roasted walnuts without added oils or sugar. Store them in the refrigerator to preserve their delicate fats and prevent oxidation. Here's one gentle reminder. Walnuts are high in calories, so moderation matters. Eating more than 2 ounces daily may lead to excess fat intake, even though it's healthy fat. Also, if you're on blood-thinning medication, consult your doctor before dramatically increasing your walnut consumption, since their vitamin K content can affect clotting balance. Walnuts are a near-perfect diabetic food, anti-inflammatory, heart protective, nerve healing, and deeply nourishing to the body and brain. They don't just prevent complications. They help reverse the silent damage diabetes causes every day. Their balance of healthy fats, fiber, and minerals makes them one of the smartest foods any diabetic can add to their routine. So the next time you crack open a walnut, remember, it's not just brain food, it's metabolic medicine. Up next, we'll look at another rich, buttery nut that rivals walnuts in flavor and diabetic healing power. Let's discover how pecans can stabilize blood sugar, improve cholesterol, and support nerve and heart function with every crunchy bite. Third on the list, pecans. Soft, buttery, and deeply aromatic. Pecans are often seen as a dessert ingredient, but for someone living with diabetes, they're far more than that. These rich, golden brown nuts are among the most heart-protective, anti-inflammatory, and blood sugar-friendly foods nature has to offer. They're filled with plant-based fats, antioxidants, and minerals that work together to improve insulin sensitivity, nourish the nerves, and lower the risk of heart disease, the #1 complication of diabetes. What's remarkable is how pecans deliver indulgence and healing at the same time. Creamy flavor, satisfying crunch, and measurable metabolic improvement with every bite. Let's start with their blood sugar impact. Pecans have a glycemic index of just 10 and a glycemic load close to 0, meaning they have virtually no direct effect on glucose levels. A 1-ounce serving, about 19 halves or 28 grams, provides approximately 196 calories, 20 grams of fat, 3 grams of protein, 4 grams of carbohydrates, and 2.7 grams of fiber, which equals about 10% of the daily value for fiber. But what makes pecans extraordinary isn't just their macros, it's their micronutrient richness. The same serving contains 1.3 milligrams of manganese, 56% of the daily value, 34 milligrams of magnesium, 8% of the daily value, 0.3 milligrams of copper, 33% of the daily value, 0.2 milligrams of thiamine, 16% of the daily value, and 116 milligrams of potassium, 2% of the daily value, along with small amounts of zinc, phosphorus, and iron. These nutrients support muscle and nerve function, help insulin bind more efficiently, and reduce oxidative stress at the cellular level. Pecans are particularly powerful because of their monounsaturated fats, primarily oleic acid, the same heart-healthy fat found in olive oil. These fats slow down digestion, lower LDL cholesterol, and keep you full longer. In fact, studies show that replacing refined carbohydrates with a small handful of pecans daily can reduce total cholesterol by 11%, improve HDL, good or not cholesterol, by 10%, and stabilize post-meal blood sugar by nearly 20%. This dual action, lowering both sugar and cholesterol, makes pecans one of the best foods for preventing diabetic heart disease. But their healing doesn't stop at the heart. Pecans are loaded with polyphenols, particularly ellagic acid and catechins, which act as potent antioxidants. These compounds neutralize free radicals that damage the pancreas and blood vessel walls. One research study found that pecans rank among the top 15 antioxidant foods in the American diet, providing nearly twice as many antioxidants per ounce as almonds. This level of protection helps reduce oxidative stress by up to 35%, shielding the nerves, kidneys, and retina from long-term diabetic complications. Inside the diabetic body, pecans also work like metabolic stabilizers. Their magnesium and thiamine improve how cells use insulin and convert glucose into energy. Magnesium acts as a cofactor in over 300 enzyme reactions, many of which regulate glucose metabolism. People with higher magnesium intake have been shown to experience a 19% lower risk of type 2 diabetes. Meanwhile, thiamine, also known as vitamin B1, supports energy production in nerve cells, reducing the tingling and numbness associated with neuropathy. Together, these nutrients turn pecans into a natural defense system against both high blood sugar and nerve damage. What sets pecans apart from other nuts is how deeply they nourish the nervous and hormonal systems. Their healthy fats and vitamin E repair the myelin sheath, the protective coating around nerves that often deteriorates in diabetes, helping restore communication between nerves and muscles. They also help balance hunger hormones like leptin and ghrelin, keeping appetite stable and reducing late-night cravings. For diabetics struggling with energy crashes or emotional eating, a small serving of pecans can provide a sense of calm, satisfaction, and steady focus without the glucose roller coaster. Here's a fun fact. Pecans are native to North America and were considered sacred by indigenous tribes who used them as both food and medicine during times of scarcity. The name pecan comes from an Algonquin word meaning a nut that requires a stone to crack. That symbolism holds true even today. Pecans are tough on the outside, but soft, healing, and nourishing within, just like the resilience it takes to manage diabetes every day. Let's make it practical. The ideal diabetic-friendly serving is 1 ounce, about 19 halves per day. You can enjoy them raw, roasted, or chopped into salads and yogurt bowls. Here's a quick recipe. In a small pan, dry roast 1 ounce of pecans on low heat for 4 to 5 minutes. Sprinkle a pinch of cinnamon and a dash of crushed flaxseed. Cinnamon enhances insulin sensitivity, while flaxseed adds omega-3s and fiber. This warm, aromatic snack helps stabilize blood sugar for hours and curbs cravings naturally. In the United States, a 16-ounce bag of raw pecans typically costs between $8.99 and $10.99, or about 55 cents to 70 cents per serving. While slightly pricier than peanuts or almonds, pecans pack exceptional nutrient density, and just one small handful a day delivers lasting benefits for the heart, brain, and blood sugar. Here's one gentle reminder. Pecans are calorie-dense, so moderation matters. Eating more than 2 ounces at once can lead to excess fat intake. Also, choose raw or dry roasted versions. Avoid candied or honey-glazed pecans, which can contain up to 15 grams of added sugar per ounce. For maximum freshness, store them in an airtight container or refrigerate them, as their healthy oils can turn rancid if left out too long. When you put it all together, pecans are more than a treat. They're a nutrient powerhouse for diabetics. They reduce inflammation, improve insulin function, support nerve regeneration, and protect against cardiovascular stress. Their satisfying crunch makes them not just food for the body, but comfort for the mind, a daily reminder that healing can be delicious. So the next time you enjoy that buttery crunch, remember, pecans aren't a guilty pleasure. They're diabetic medicine in disguise. And when combined with foxnuts, pecans, and walnuts, they create the ultimate trio for diabetics: fiber from foxnuts, omega-3s from walnuts, and antioxidants from pecans. A perfect balance of healing, energy, and protection for your blood sugar and overall health. If you found this video helpful, give it a like and share it with someone who needs it today. Don't forget to subscribe for more science-based, natural diabetes nutrition videos every day. And tap the bell so you never miss a new one. Remember, diabetes isn't managed in the pharmacy. It's managed in the kitchen, one smart bite at a time.